This technology is being used in a range of specialties, from reconstructive surgery to orthopedics. In addition, 3D printing allows surgeons to practice complex procedures in advance, reducing the risks and complications associated with surgeries. The use of virtual reality, VR, and augmented reality, AR, is also becoming more prevalent in the surgical field. With VR and AR, surgeons can visualize the patient's anatomy in 3 dimensions, allowing for more accurate and efficient surgical planning. This technology is particularly useful in neurosurgery, where the brain's complex structure requires a high level of precision. Another area where science is transforming surgery is in the development of nanotechnology. Nanoparticles, which are particles that are incredibly small, are being used to deliver drugs directly to the site of the surgery, reducing the amount of medication needed and improving recovery times. Nanotechnology is also being used in the development of new surgical tools, such as tiny sensors that can be implanted in the body to monitor vital signs and detect infections. In conclusion, the use of scientific innovations in surgery has transformed the field in recent years. Robotic-assisted surgery, 3D printing, VR and AR, and nanotechnology are just a few of the ways in which science is revolutionizing surgery. With these advancements, surgeons can perform procedures that were once impossible and provide patients with safer, more efficient, and more personalized care. As technology continues to advance, the possibilities for the use of scientific inventions in surgery are endless. As technology continues to advance, the medical field has seen incredible innovations in surgical procedures. These developments have led to better outcomes for patients, improved safety for medical professionals, and more efficient use of resources. In this article, we will explore some of the latest applications of scientific breakthroughs in the field of surgery. 3D printing. One of the most significant advancements in surgical technology has been the use of 3D printing to create models of patient anatomy. Surgeons can now use these models to practice procedures before operating on the actual patient, improving accuracy and reducing the risk of complications. 3D printing also allows for the creation of customized implants and prosthetics, which can improve patient outcomes and reduce the need for additional surgeries. Robotics. Robotic surgery is becoming increasingly common, as it offers several benefits over traditional open surgery, including smaller incisions, less pain, and a shorter recovery time. Robotic surgery involves the use of a surgical robot, which is controlled by a surgeon using a console. The robot's arms are equipped with surgical instruments, allowing for precise and controlled movements during the procedure. Image-guided surgery. Image-guided surgery is a technique that allows surgeons to visualize the patient's anatomy in real time during the procedure. This technology uses imaging techniques such as X-rays, CT scans, and an MRI to create a map of the patient's body, which is then displayed on a screen in the operating room. Surgeons can use this map to guide their instruments and make more precise incisions, reducing the risk of damage to surrounding tissue. Nanotechnology. Nanotechnology has also had a significant impact on the field of surgery. Nanoparticles can be used to deliver drugs directly to diseased tissue, reducing the need for invasive procedures. Nanoparticles can also be used to create materials with unique properties, such as self-cleaning surfaces, which can reduce the risk of infections during surgery. One of the most promising applications of nanotechnology in medicine is the targeted delivery of drugs.